heard the cost of healthcare is too expensive and is out of control. And what we're looking to do today is to start work on a concept that will actually improve care and reduce cost. I know that's hard to believe, but it is doable. It is very possible to get done. And what we're talking about here is primary care centric, where you go to a doctor like you used to when I was a young man and spend the time that's necessary to get and establish a relationship with the doctor where they get to know you and they manage your care. We have access 24/7 to that doctor. Two ways of looking at this. One, we're going to reduce the cost to the patient, but we're also going to reduce the cost to government. 84% of healthcare dollars are spent on chronic illnesses like diabetes and heart disease and high blood pressure. They're all treatable if they're managed properly. And that's part of the focus and the process we're trying to get to here. But I'm going to ask, start with Mark Bloom, who's head of America's Agenda, to start discussing this. And I'll give examples where this does work. I would love to say that this is the first in the nation, but it's not. It's just a focus on moving healthcare forward in a way to make it more affordable to the taxpayers and to the workers. Mark?
Thank you very much.
Please.
Thank you very much, Senator. I'm pleased to be with you today. I'm Mark Bloom, Executive Director of America's Agenda, Healthcare for All, an organization whose mission as a not-for-profit organization is to bring together labor, bring together employers, bring together healthcare providers to find the common ground for meeting the objectives that Senator Sweeney outlined, to improve care quality, thereby reducing costs overall, and improving patient satisfaction and access. Those goals are achievable, and we want to talk to you about the architecture for achieving those goals. The principles of the plan are well established. They've been piloted in numerous settings, from public sector settings, beginning back in 2006 in Vermont, to private sector settings. And we're looking at cost savings that range in the area potentially of 5 to 15% per annum. In health plans that cost billions of dollars, as yours do here, we're talking about lots of savings potentially for the state through redesigning the way care itself is delivered. The plan would roll out in this kind of fashion. Pilot plan programs, while there's 800,000 total potential lives covered by the two state health benefits plans, it's a 60,000 person pilot, a relatively small pilot, in 5 regions of the state. 2 pilots in northern New Jersey of about 10,000 members each, a 20,000 person pilot in Mercer County, Greater Trenton, and potentially 2 10,000 member pilots in southern New Jersey, 60,000 altogether. Participation in these pilots by public employees would be entirely voluntary. And providers to participate in this pilot will be invited to participate if they can meet the specifications. That is, if they can provide the kind of health care that the state employee benefits plans would be saying, we want to deliver because we know it's cost efficient. We would require that providers guarantee same-day, next-day access for patients with urgent care needs, that patients have 24/7 access by telephone, by text, by email to their personal physicians. We would require that practices have electronic medical records, as some minority of primary care practices do today in New Jersey, in order to participate in this program. And we would also be specifying that they identify high-value referral networks within the current PPO networks. Those specialists and hospitals that offer the top-tier quality care at competitive prices. We'd be asking New Jersey providers to compete for the business of the plan in a way that's never happened before. It's a market-based solution. We're asking for providers to do something that rarely happens in healthcare today, actually compete on the basis of quality and price. The question arose, would physicians in New Jersey be willing to step up and provide this kind of care under those specifications? And so I'm very pleased to tell you today that the answer has been a resounding yes. In fact, we've been overwhelmed by the willingness of physician groups to actually step forward and provide care and compete for access to providing, or the ability to provide care to public employees. I'd like to introduce to you today two physicians groups. They're the highest performers in the two rankings we look at in New Jersey, who basically said enthusiastically, if this plan were in place, we would be applying and look forward to stepping up and providing care and generating savings to the state by so doing. The first group I want to bring to your attention is Optimus Healthcare Partners.
About 10 years ago, I was ready to quit. Medicine was not fun anymore. The healthcare system had totally lost its focus. It wasn't patient-centered. I was running from room to room to see as many patients as I could each day because I was rewarded for volume. Then I go into a program where I was measured on how successful I was in performance in managing my patients. Let's go ahead and change this. Let's embrace a patient-centered model of care. And this kind of model, what we've done now is we've been able to increase the access for our patients, the ability to get appointments, timely for their needs, and to communicate with us 24/7. We've been able to use technologies like the electronic medical records, patient registries, in order to find the patients who need care. We don't wait for the patient to call us, we call them and make sure they've had their screenings and their immunizations, things that they need. And then
We are very excited by Senator Sweeney's proposal for the direct centered health care for New Jersey public employees. And I brought some physicians with me today who are also equally excited by this program, because we have actually taken the theory of this, which is, for those of you who don't know, the national term that's being used, the triple aim. And the triple aim is increased quality, decreased cost, and increased access.
I think what's important for the people that are listening to this to understand is that this isn't a vision or a concept. This is a model that has been developed. People like Dr. Tedeschi, and through his leadership, Mr. Bloom and others, have been developing this and evolving this for years. And it is a product that is going out to the market in segments, but now through the leadership of people like Senate President Sweeney, the labor leaders that are here today, to do this on a mass scale that can bring attention to people that are trying to figure out how to utilize healthcare as they're being reintroduced to it for the very first time. Steve's leadership in this is critically important, not just as a Senate President, but as a labor leader who understands that the men and women that he represents need healthy bodies and healthy minds in order to do their jobs well. Healthy bodies and healthy minds are done not through disease management crisis, but through early detection. This will create a better relationship with a direct line of care between primary care physicians and their patients. It will educate patients along the way. The multiplier effects that you see from initial numbers of 5 to 15%, or what Dr. Tedeschi has talked about at a 17% savings in the second year, will multiply not just in the potential savings at rooting out waste, but by the early detection of disease and conquering disease early on, making people healthier. And those savings almost can't be calculated as we move forward into the out years of this program. This is not a model that is designed to take benefits away. This is a model that is designed to allow members to utilize their benefits earlier in a more educated way with a direct contact with their primary care physicians, which I believe not only will you see from the data that is collected increased metrics and quality measures, but you will see what should be equally as important as it is in every other business, customer satisfaction scores from the patients that will enjoy this experience and have enjoyed this experience in markets around the country far better than their current model of reacting or using healthcare in a way that they've grown up in this culture. So I applaud my friend Steve Sweeney for doing this. I applaud our friends in labor for coming here today.